Okay, here we are again, Ashley and Christy, still talking respiratory. So now we are going to talk about interventions that are done to improve expansion of the lungs and to improve the patient's ability to take a deep breath. And so the first thing we're going to talk about is an incentive spirometer, which basically is an incentive spirometer. So the spirometer part is the fact that when you breathe in, it's a spirometry, it's measuring something. And the incentive part is that you get a score every time you take a deep breath in. So that's why they call it incentive spirometry, because we're measuring our capacity of our breathing, our inhalation, and the incentive is that we're going to feel better, we're going to be able to breathe better, and we get a fancy number when we do it. We see a cause and effect, immediate gratification. So that's why it's called incentive spirometer. So the reason that we use these incentive spirometers is to increase the capacity of the breath. So we are expanding the lungs. And why would we need this? So patients who have lung restriction, like chest trauma, they were in a car accident, they had open heart surgery. Typically, if you're in pain or you've had some sort of trauma to your chest cavity, you're not going to be able to take a deep breath in. You're going to be taking slow and shallow breaths, and when that happens, our lungs don't expand all the way, and then we start stacking our breaths, and pneumonia can set in because we've not expanded it. Typically, this replaces the yawn reflex. So if you take a nice deep breath and you yawn, you'll do a natural breath hold right at the peak of your inspiration. That is what this is. And it's hard to do that if you're in pain or if you have pneumonia and there's fluid in your lungs. It's hard to expand. So that's what this replaces. So typically when you get one of these ordered from the doctor, they're going to say that we want the patient to do it 10 times an hour while awake, or it depends on what the situation is, but typically it's going to be 10 times an hour. But make sure you read your orders, because there are like 3 or 4 sims in the sim lab where there's very specific number of repetitions for the patient to breathe on, okay? And so let's talk about what all this stuff means, all right? So this tube here is the corrugated tubing. This is the dead space, same thing that was on the nebulizer. It allows the deep breath, and then the mouthpiece, all right? And so then you have the handle, this is the indicator that goes up and down to tell the patient, okay, we want to get to 1250. This shows them what you're looking for. This is the incentive, right? We want to hit that number right there. The way to do that is that there's an indicator over here that is going to go up when you take a breath on the mouthpiece. If you breathe too fast, this indicator is going to hit the top of this part here and you're going to hear it. And if you do that, some things are going to happen. 1, it's not going to be effective. 2, it's going to hurt, especially if you have some sort of trauma to your chest and you breathe fast like that. It's not going to feel good, and probably the patient is going to be like, nope, get rid of this. I don't want to do it no more. That wasn't cool. So we want to tell them right away from the get-go, this indicator needs to kind of levitate it right here in the middle. We want it to hang out right in the middle. And the way to do that is to take a slow, deep breath, and you want to control your breathing, right? So when you're doing that, you're doing one of these. And that's how you want to show them how to do it and then have them do it, all right? When they breathe in, this is going to move up if they breathe in correctly. The idea is to inhale. You're sucking on this mouthpiece to get this to come up, okay? That's the idea of this device. So I'm going to give her instructions, and she is going to do it wrong the first time, and then she's going to do it right the second time, just so that you can hear what the sound sounds like when the patient is doing it. Okay, Ashley. So the doctor ordered you on this incentive spirometer, and this is going to help expand your lungs. Right now you have pneumonia, so it's hard for you to take a deep breath in because of the fluid that's in there. So I want you to practice doing this. Doctor ordered it 5 times an hour while you're awake, so we won't bother you in the middle of the night. But it's important to do this. It's a very simple task. It's not always the most comfortable thing, but it is an easy way to prevent the pneumonia from getting worse. Okay? So this is the handle. This is the tube. You're going to put this in your mouth. Make sure you have a nice seal around it. And the idea is we've put you on a certain number, which is usually set by the respiratory therapist or doctor. Typically, it's an equation that they figure out based on the patient's age, height, gender, stuff like that. And then it comes in a little pamphlet. It's on there. You can figure it out. So your goal is 1,250 cc's or milliliters is what we're measuring here. And so what you're going to do is you're going to put this in your mouth, and you're going to hold this, and then you're going to take a nice slow deep breath in to expand the lungs. Okay? And when you do that, this little toggle here is going to move up. And if you breathe too fast and too hard, it's going to hit the top. It's going to make a noise, and that may or may not hurt. So for it to work and be therapeutic, we need you to control your breath hold, take a deep breath in that's slow, and this will kind of levitate right here, right here. It says keep between the arrows, all right? Okay. When that happens, this is gonna rise, and hopefully it hits 1250. Okay. Okay. If you don't hit 1250 right away, that's fine. We can start down here and work our way up. The goal is to just improve. Okay. Okay, so why don't you try that? All right. See if you can do what I told you to do. Okay, so that noise, you see how that thing went right up there and it hit the top? Mm-hmm. Okay, so that was a breath that was too fast. Okay. All right, so we want this to kind of levitate and just hang in the middle of those arrows. Okay. So try to do that. Good. Good job. Is it harder to levitate and try to keep your breath hold like that? Yes. Yes. Okay. And so the more and more you do this, the easier it will get. Okay. And so why don't you do it one more time? Perfect. And she actually did improve the second time compared to the first time that she did it when she did it the right way. And so when you're listening to that noise on there, you can hear that toggle. It's just sort of hanging there. That's when you know your patient is doing it right. When it hits the top really hard, it's probably going to hurt, and they're not going to want to do it no more. So if you just kind of lay out the instructions right away, it will really help you have a better relationship with the patient, and they'll trust that you know what you're doing with this incentive spirometer, and that they know you're trying to help them. Okay, Ashley, so we did your incentive spirometer earlier, I think. The nurse wrote it down, and it looks like you got 500 on this last time. Can you show me, can we do it again? Yeah. Okay. You remember how to use it? Oh, yeah. Okay. Yep. It didn't go up. Yeah. So the goal is to inhale. You blew out. That's why nothing moves. Oh, yeah, I was blowing it. Okay. So why don't you take a slow, deep breath in. Try to keep this in between the arrows. Kind of levitate. You'll see it move, and then this will move up for you. Okay. Good job. Awesome. Okay. See how that moved? Yeah. All right. So we're always going to suck in on that. Okay. All right. Does that make sense? Yep. Okay, good.